Eureka is it's a network of excellence, and Eureka is short for European Micronutrient Recommendations Aligned. We believe that now we have chaos across Europe, if you like, with different nutrient recommendations in different countries, different levels. You cross the border from Belgium to Germany and all at once you need more vitamin C or less vitamin A. But it's not just a scientific issue, because if these recommendations are wrong in at least some countries, that means the basis for what we advise people to eat is not right. The basis for maybe how much vitamins or minerals we allow to be added to foods is not right. So to handle all that and to overcome all that, we think it's important to create clarity and to align ourselves across Europe with regard to how much of the different nutrients we recommend people to consume.
It's very important to involve West Balkan countries and Central and Eastern European countries, because in this region we have a lot of low-income and immigrants population. There are many of the reports already published that the nutrition of low-income and immigrant is very low.
It's very important to be in Eureka because this will drive the future of European nutrition science and, say, industry as well. And it's especially important for small and medium companies, but do not have the resources sometimes to conduct research by their own.
We identified what the different health endpoints were that the different European countries use to determine their recommendations.
The first thing we need to have in mind is that children are not small adults, so they are very different. They are growing, they are developing from different points of view. So the recommendations need to have into account these considerations.
One of the nice, say, extras of Eureka is that apart from the research, we also have training activities, education and training. And the training is specifically aimed to work also in the Central and East European countries. There's a lot of knowledge and methodology developed in the, say, the West European countries, but one of the places to use it and to train people is in the Central and East European countries. And I think that Eureka has large opportunities to do so, to develop courses with computer-assisted modules in it, but also by inviting experts from all over the field and have them as keynote lecturers and speakers and discussants in such courses. And I think that will help Eureka to realize what the real needs are of countries that do not have all the possibilities yet that are available in the west of Europe.
It's important for scientists to understand how can they best feed into those different processes with the science and knowledge that they have. And for that we do need to understand what the differences are across Europe and how best to ensure that the best evidence gets fed into the decision-making processes so that we can hopefully all end up being more healthy.
What we will be very interested in the Nordic countries when we are setting new recommendations, that's all the literature work that has been collected. It's really a tremendous work that already has been done.
I think that the collaboration between so many stakeholders is absolutely exceptional, and I think particularly that it's not just the academic scientists or the government scientists working together, but they're bringing in other stakeholders, the users, the industry, and I think by having that kind of stakeholder engagement from the beginning is bound to lead to a product that will be much more successful and usable.
This is really on the human level a very great experience, because there's people, sometimes have a meeting, 100 people, 30 countries there, and it's our job and our privilege also to bring them together, to learn from them, to understand them, and to really integrate and to produce something together which could not be possible sitting there in our own countries with our own ideas. So very exciting, very challenging, and quite a privilege to be heavily involved in.